things have changed considerably since I was nursing. The progress has been really something. Yeah, I'd love to be able to work in that type of environment now.
It meant a lot to me. I got involved with it, and during my time with the board, and also was coming up my 29th year as a canvasser, and found out how much the donors, the people I've talked to and approached, were in favor of the foundation and prepared to donate and help out. Still goes today, and that's the reason I keep going on it.
When I started working with the foundation, it was me part-time and a shared administrative assistant. We grew from that point to a really dedicated team of 9. There have just been so many projects over the years that come to mind, thinking about helping to raise funds for the first MRI unit in the province. One of my favorites is the rooftop garden that patients can enjoy. And the list just goes on and on. Then the most recent capital campaign was launched in 2018. By far the most ambitious, with a goal of $8 million, which actually exceeded that goal by over $2 million. And that was for the new obstetrics and newborn care unit, which we just celebrated the opening of very recently, and it's just a fabulous, fabulous addition to the hospital. And we'll be very excited to see the completion of the cardiac care unit, which the capital campaign also helped to fund. If we were to go up to the top floor of the hospital today and walk through unit by unit down to the basement, in every unit we would see something that is there due to the philanthropy of the people of our community.
Without the kind of donations that we have received over the years from the Friends, we wouldn't be able to keep up with the needs of the day. We have recently had acquisition from the Friends of extensive equipment for brain stimulation. Well, this is a big step forward. The desire of the Friends to raise that kind of funds enable us to purchase these other items which just have changed so many aspects of medical care. We'd be back 40 years ago.
I'm relatively new to the foundation, and it was apparent from early days what a robust history it has of thousands of donors and partners who've come together. And it's such a strong foundation to build on. So I'm very excited to continue to build on these 5 strategic pillars: cancer care, women and children, brain health, mental health, and innovation. The role of the foundation in philanthropy is not to maintain the status quo, but really to help advance the standard of care at the Moncton Hospital. And what is apparent is a lot of the projects or innovations we were able to bring at the Moncton Hospital came from our frontline and patient directly. So these are ideas that were advocated for and brought forward as ways to improve the outcomes for patients, but also the quality of life. Most people that I come across have had a personal experience with the Moncton Hospital. Their children were born here, their parents were treated, maybe they were also hospitalized here. So it really is at the heart of our community. I think together there's nothing we can't tackle.